Hey guys, yes, I'm running late. Whew. Today has been crazy, crazy, crazy. Let me tag some of you guys in. So, let's see what's happening. Why is my fingers not working? I don't understand. You got. Guys, I hope you guys are having a great Thursday. I have been trying to have a awesome Thursday. You know, feeling super good, feeling good, and I hope you guys are too. So I am tagging as many of you guys in as possible. So some of you may want to. Some of you guys will catch me, some will not. Some are busy. But Katisha is here, and I'm showing up as I said I would. So I'm happy about that. So I just tagged a whole bunch of you guys in. Hey Fatima, thanks for joining. Yeah, so I just tagged you guys in. And so if you're watching and you haven't met me yet, I'm Katisha Willis with Intuitive Medical Coding Made Simple. I am a certified coder, instructor, mindset, and mentor coach. I help aspiring medical coders get unstuck and push through their coding obstacles. I mentor them. I create customized medical coding programs specifically to CPC. So I go through, review, and everything. But today I am jumping on here because, as promised, I said that I would give you guys a few notations in your ICD-10 CM book, because we have some in the group that is getting ready. Hey Christy, that's actually getting ready to take their exams, which I am so excited for you guys. So I kind of wanted to start off in the conventions, just something that, you guys can like underline, maybe document on the side. Make sure you guys know the 4 organizations that govern these books, how these books come to be. Make sure you know. And that should be right at the front of your book. And those organizations is, the AHA, AHIMA CMS, and NCHS. So that will be a test question that they will attempt. Hey Lydia, how you doing? That they will attempt to ask you, and I think that falls in, if I'm not mistaken, it's going to probably be in the compliance domain on the test, which is towards the back of the exam. Okay, and just remember, on the exam, yes, you can go from front to back or back to front. It's totally up to you. But I always say do the easiest things first, which is normally like your medical terminology, excuse me, your compliance and regulatory, your HCPCS, your ICD-10, and your A&P. Try to do those things first, because those are things that, like, if you have studied medical terminology and you're pretty good in anatomy, you can look at those and you can just go right through them. It's 42 questions towards the back that you guys should be able to easily answer. But moving on, remember that we're in the conventions part of the book, guys. So remember that NEC and other specified is just like saying you have sufficient information, but there's no code in the book that you can use to code up to the highest level. So you have the documentation, it's supported, you just don't have a code. So normally the code that you would be picking would be something that would have a 8-9 or something like that on the end, okay? So remember that, because sometimes that trips you up, because you're like, why is this saying NEC, not S where classified, or why is it saying other specified? It's just that you do have the sufficient documentation, but there's not a code for it. So just put a little note. So basically what I do in my book, next to NEC and other specified, I have put sufficient medical record, no code in book. Okay. And then for NOS and unspecified is insufficient documentation. So this is where you would see the I-50.9, like for congestive heart failure, and there was nothing specific to say whether or not the congestive heart failure was systolic or diastolic, or it was combined. Then you're going to be coding like a I-50.9 because that's unspecified, because the documentation, yes, though it supports congestive heart failure, it doesn't give you the specific type of heart failure that it is, okay? So that was other, and NOS is the same as unspecified. So kind of that's what that is. So you would want to put notes like that, okay? Sufficient documentation, insufficient documentation. So that's for that. Your excludes one is do not code here. So if that above code has a excludes one, and then the conditions that it has is also there in the chart, and is the reason for the emission or the reason for the stay or the visit, then you're not going to want to code that above code, okay? Because you can't code those two together. That's what that excludes one is telling you. So the note that you should put where you have excludes one is do not code here. And then as long as you're paying attention to the specific conditions, you should not miss this with excludes one, because when you see that note do not code here, you know automatically, okay, let me go look somewhere else for whatever it is. Excludes two is when both of the conditions are present at the same time. So the note that I put there is to code in addition to. So basically, say if you had pneumonia, the patient had pneumonia, but they're also being treated, like they're being treated for the pneumonia, and they're being treated for not congestive heart failure, but acute respiratory failure. Then what you're going to want to do is you can code either one of those, because they're both being treated. If there's an excludes two note, that would be a similar example. If it's an excludes note and then that falls underneath it, then you can code those two together, because you're coding a condition that exists on that visit that is actually being treated. Okay. And then remember, when looking at the etiology and manifestations, some of the good ones to really write down in your book is like making sure that you know what the signs and symptoms of pneumonia is, what are the signs and symptoms of COPD, signs or symptoms of a person that's having a seizure, because normally a person that has a seizure, they might stare into space. You can tell that they may be unconscious, or they're breathing heavily. There's a lot of, and then like with pneumonia, you got cough, pain in ears, headache, stuff like that. You want to pay attention to, and those are good things, because believe it or not, they're going to use that pneumonia scenario every freaking time. I don't care which test I took. It was always something about pneumonia, and it was like in 3 different types of scenarios, because they are really testing to see if you know winter cold or winter cold pneumonia and winter cold the diagnosis. So if you see something where it says pneumonia, and then you see all these signs and symptoms, these R codes within your answer, well, you know, if you saw in the scenario that the doctor diagnosed the patient with pneumonia, you know that the coughing, the sneezing, the mucus, you know, all of that are signs and symptoms of a patient that has pneumonia. And it specifically is stating in your A&P or your impression plan in that scenario that the doctor diagnosed the patient with pneumonia and also treated the patient with vancomycin or some form of antibiotic. Okay, so when you see that, you're not coding those R codes. So if you see a answer and it has those R codes in it, and you specifically see that the doctor has diagnosed pneumonia, that's not your answer. Okay? And the one thing I love about, the fight that is multiple choice, it's like this. You either going to love the code or you're going to hate the code. Either the code is going to make sense or it's not going to make sense. So that's why I wanted to do this, to kind of like go through, so I can kind of like give you guys a little bit of tips as I'm going through. That's etiology and manifestations. So we know that and means either. So if you have 2 conditions and they're being connected by the word and, that could be either and or. If you have something that says with, which basically means associated with or due to, you're going to have, with means due to or associated with. So that's how you would be connecting that. So for instance, ascites is basically fluid in the lungs or in the peritoneum area, okay, depending on what the condition is, okay. So you're going to find fluid, okay. So when you have that, they might say the patient has pneumonia, but the ascites is due to or the pneumonia is due to the ascites, depending on like if it was growing like gram negative, because they're going to do cultures and stuff like that. So those are the things that you guys would want to look at. So when you see and, you know that it's either or, it could be either one of those conditions. With is associated with or due to. When you see something that says C or C also, this is talking and pertaining to the index, okay? When you see something that says, for instance, I seen something today where me and another person was looking at something for gouty arthritis. So typically in the index, you're going to look at arthritis because this is what the patient has, okay? And then you're going to want to go down to gout. Well, gout says C also gouty or gout. So then you're going to go to gout and try to locate and see what that is. And it's going to give you 2 separate codes depending on whether it's acute gout or chronic gout. And then you would go into your tabular and just validate which one it is based off the documentation or the scenario that you're reviewing. Okay? Because it's different. It's a little bit different. So that's for that one. You guys know that the code also it may mean that you need 2 codes for that. Let me see, what else did I have here? We're not coding any signs or symptoms. So if there is an actual diagnosis we're going to code the diagnosis. We're going to decode what the definitive diagnosis is. If it's something where there was no definitive diagnosis and the patient had, all these different signs and symptoms, then and only then can you code that. Anything else, you're not going to be coding that if you have a definitive diagnosis. Okay? Remember that with acute and chronic conditions, you're going to code both. But if the patient has both of those, you're going to put the acute condition first. That's going to be sequenced first. Let me know if this is helping you guys. If it's not helping you, we can move on to something else. But if this is helping you, let me know that it's helping you. Because most of you guys may already know the conventions, but these are just little notes and little things that I've notated in my book. This helps my students. This helps them have a better understanding, especially when I can take my time and go through it. So if it is helping you, comment 1 so that I know that you guys are paying attention and this is something that you truly that this is helping you. If you're still on the live. Let me see what else we got going on. That was pretty much it in the thing here. I wanted to talk about, let me see. I have 2 books here, guys. I'm sorry. I have one book that has some stuff in it, another book that has some more stuff in it. Okay, so I don't know if you guys have an issue with HIV and AIDS, and how this will appear, but let me see. I have some notes here that maybe you guys can jot down in your books, or I can post them in a chat in the comment section for HIV and asymptomatic. Because see, when you see these conditions, like on your test, they're going to test you on this because they want to know that you know the difference between asymptomatic and a patient that actually has AIDS. Because asymptomatic is like, yes, that is documented that they have HIV, but they have no symptoms. No symptoms have been documented, and so you're coding Z21. But when a patient is HIV positive, they've had some form of HIV related condition or diagnosis in the past history or currently, like it's currently being treated or they've had it in the past, then you're going to code your B20. But I have specific conditions that you guys can write in your books, and I can put those in the chat if you want. Because like a AIDS defining condition would be something like the Kaposi sarcoma, which is a form of pneumonia that only AIDS patients get. And so these things are just like a check for me. So like when I'm looking at something related to AIDS or somebody that have HIV, I look at and see specifically, did they have any of these conditions at all? And let me see something. See, I put certain notes in here. So like if they had a CD4 count greater than 500, or not at risk for like any opportunistic infections, this would fall up under Z21. So so stuff like this, I could definitely send something out. If you guys want me to, I can put it into like a little note and either email it, or I can put it down in the comments and you guys can copy it later. But it's specifically for HIV. This will be so helpful, especially because they're testing you to see if you can recognize the difference. Can you recognize that there is something specific to a HIV related condition? Okay, awesome, will do. So, because that's what they're going to test you on, to see if you can just tell the difference. But see, what happens when you get on the test, most instructors don't really give you the breakdown of that. And where you can write it in your books. Like, they'll tell you the formatics of what that guideline is, but they don't give you the specifics of what to look at. So for instance, you're on the test, you get some form of a scenario for HIV or full-blown AIDS, and you're like, okay, they got a Z21 and they got a B20. Okay, how do I distinguish between which one do I need to do? So if you have a scenario that gives you past history, and you can look at, okay, this patient had Kaposi sarcoma. Okay, that's a AIDS-related condition, a HIV-related condition. So in your mind, it should flag ding, 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 B20 automatically, because you're going to have to code that, because they have a condition of a HIV-related condition. So you have to code that. But if you saw something and it said the patient was HIV positive, but you don't see no signs or symptoms, then you go and you look at the past history in the scenario, and you don't see any HIV-related conditions or signs or symptoms, then you're coding the Z21. So I'm going to make sure to put that down in the chat. And for those of you who I have your email, I'm going to send that along with the E&M information that I spoke about yesterday. Let's look at, let's see, we talked about that. Did I talk about sepsis? Because sepsis is a tricky one sometimes for coders. But I'm trying to look and see where my sepsis first starts at. Okay. So when we look at sepsis, we're thinking about how did the patient become septic? So like when you see a code or you see a scenario and they're saying that the patient has sepsis. So normally that's code A41.9. And one of the things you want to look for is, what was the reason for the visit? In all these scenarios, there should be one major thing that you guys look for. Why did the patient go to the doctor's office? Why did the patient go into the facility? You want to know what was the reason for the visit. And then you want to look at, this is a quick way to get to information. I'm looking at a scenario. For instance, let me just pull out this little book. See, I got so many books, y'all. Okay. This is actually from the study guide, okay? But let me see if I can find a quick scenario for us real quick. Oh, they are not playing this year. Ooh, Lord. They're not playing. Let's just think about this from this standpoint. When a patient comes in for sepsis, there's something normally underlying about it, okay? And they have to do cultures. They got to see if the culture is growing any type of gram-negative, gram-positive. What is it that's making this patient so septic? Did they have pneumonia? Did they have anything that was underlying? Why did they come in? Why were they transferred to a facility? So you have to always remember that on that test, the quickest way to get to the answer that you're looking for is that you want to look the reason for the encounter. Why are they there? The second thing, you want to look at the A&P. So it's either going to say A&P or it's going to say impression plan. For those of you who don't know, and wondering what did the doctor really diagnose with on there. That's what you're going to want to look for. You're going to want to look for A&P or impression plan. The A&P is going to let you know what that doctor diagnosed that patient with. So see, you sitting up there trying to read the full scenario, right? No. What did they diagnose this patient with? And then when you look and you see what they diagnosed the patient with, if you need to go back and you need to look for anything else that's pertinent to that case, hey Brittany, thanks for joining. Anything that's pertinent to that case, then you go back up. But when you get that scenario in front of you on that test, because this is how you cut down time. You look at the scenario and you say, okay, let me figure out real quick, why was the patient there? Oh, the patient was there because they were doing a follow-up or whatever the case is. Okay, the next thing you do is you go to the A&P. Okay, assessment and plan. Okay, what did they diagnose the patient with? Oh, it was pneumonia. Okay, how did they treat the patient? So then you look and you see if you see anything with antibiotics, vancomycin, anything so that you can see what they was treated with. Okay, then when you get into your answers, right then and there. Hey girlie, right then and there what time it is. It helps you to narrow down, it helps you to cut down time. It's, to me, yes, I want you guys to read the examples and read the scenarios, but I'm not playing no games on this test. We got 5 hours, 40 minutes. We got to make this happen. So the best way to do that is when you see that scenario come up, you go, you see why they was there. Then you go and you see what they were diagnosed with in the A&P or the impression. If you need to go back up, because you can always tell in the actual answers how it's flowing. All you need to know, just like when you're doing inpatient coding. Hey Lisa, thanks for joining. When you're doing inpatient coding or outpatient coding, is what brought the patient in there in the first place. Why was the patient there in the first place? That will help you to better have a better understanding of. I'm sorry, I'm just trying to wave at you guys. That will help you to have a better understanding of what's happening in that scenario. So I don't want you guys to get on the test and get frazzled. No, don't get on the test and get frazzled. Just know that when you look at the scenario, you want to know why the patient came in, what the patient is being treated for, what the patient was diagnosed with. So from there, you can make a good determination on the codes, because you kind of know. It helps you to just narrow down that whole situation. So going back over here, let me see what other little quick things I can tell you guys, because if you guys like this, I'll do a part 2 to this, and we can go over some real life scenarios. That way when you see them, you're not frazzled, you don't have that anxiety. It's just better for you. Should be related. Okay. So yeah, some of the biggest things in 2 is knowing your COPD. Knowing that COPD, let me tell you something about COPD, because this is what trips a lot of people up too. And if I'm not mistaken, you'll be tested on this. But one thing about COPD is that COPD includes emphysema, asthma, and bronchitis. Did y'all know that? It includes those 3 things. And it's just a progressive type of disease. So you might start out with asthma, and then it progresses to bronchitis, and then you might have some wheezing. You might need to be put on, oxygen, depending on how bad the COPD. That's why you see in the section of the respiratory pulmonary area that they want you to code also tobacco, like a person that's dependent on tobacco or tobacco use, those sorts of things. So going into iPad, share of this, and we're just going into the J1, the J44 .0 and .1 area in the book. And another thing, make sure your books are tabbed up, because tabbing is get you there fast. So make sure your books are tabbed up. So one thing I want you guys to understand is that when you go into your like, say you're looking for a code, like in this case, I'm getting ready to look at J44 with you guys. Okay, so J44 says there's other chronic obstructive pulmonary disease. Okay, in that's your category. But in that J44 category, it says it includes chronic asthmatic bronchitis, emphysema bronchitis, obstructive asthma, obstructive bronchitis, all chronic right here. But that's all included in the J44 category. But if you notice underneath it, it says code also the type of asthma if documented. So what you're going to want to do is you're going to want to make sure that you're paying attention to the documentation or the scenario that you have in front of you, because that's going to determine whether it's going to be a J44.0 or J44.1 or both, with the type of asthma or the type of particular pneumonia, if pneumonia is being caused by the COPD in one way or the other. So you want to pay close attention. And here it says they want you to code also the type of asthma, any exposure to environmental tobacco, smoke, history of tobacco, and then it has the codes next to it. So for instance, you're on the test and you see that the patient has COPD, and you coding J44.0. So you're at J44.0 and it says code also to identify the infection. So now it wants to know, is there something else that the patient has in conjunction? Do you have a video or set of instructions on the best way to tab the book and rules that apply? Yes, I do, Brittany. Yes, I do. I might get to it in this right here. Let me see, because it says more. Let me see what else you're talking about here. Okay. Tabbing for the CPC exam. Book and now have 2019 and want to make sure I tab it better this time. If you inbox me or take a picture of what your book look like right now, and then inbox me at Katisha Willis so I could just take a look. I like to look at pictures because I like to see what you're working with, so I can better assist you. But I do have a method, a tabbing system that I use. So yeah, most definitely I have instructions and what would be a good form of tabbing your book. No worries. So yeah, so at these sections, when you see at your categories where it has includes, it means that those things are included. You want to make sure that if anything in that scenario is up under this code also, that you code that, and in your book it should have the code right next to it in parentheses that you need. Also at the J44 category, it has an excludes one note that has a list of conditions that you would not code J40 anything from the J44 category if these conditions exist. Okay, so you want to pay very close attention to what the book is saying, which is why I like to kind of like go through these guidelines and give you guys any type of coding tips that you can kind of like document right next to it. Because see, this is imperative. a coder, even though you go through school, guys, even though you're going through school, you're going through courses, you're going through CPC reviews, what you guys have to understand is that when you get on this test, sometimes the information still looks foreign. You need that one piece to help you make that decision faster. And so that's what I try to do on this. That's what I'm trying to do on this live. So you really don't have to like think too hard, because you have some information that's right, you know, right there that can actually help you. So let's look at here. So for instance, the patient has COPD. There's a history of COPD. But now the COPD has exacerbated. Okay? So now what you're going to be doing is coding both. You're going to have a J44.0 and a J44.1 according to these guidelines. And then, let me see, because it says you have to assign both, followed by the specific lower respiratory respiratory condition, if one exists. And what they mean by that is like if the patient has lobar pneumonia, you're going to want to code that in addition to. So my coding tip states that if the physician confirms both a diagnosis of lower respiratory tract infection and exacerbation of the POD, of the COPD, you're going to code both. So that's what I'm saying. Make sure, because see, you guys, the book that you take in there is not going to have these little coding tips. It's not going to have it because you have the professional version. I have the expert version, and I have an instructor's manual to making sure that the way that we code is proper and according to the guidelines. So hear me when I say I'm an advocate for you guys. I want to make sure you get it, because these tests are expensive. These books are expensive. Your time and your energy is everything. You know what I mean? And this is coming from somebody who has experienced it, has went through it, has fought for it. So let me see. So you code the pneumonia first, and then the COPD. You always code the underlying condition first. So if for some reason, let's say the patient came in with pneumonia and was having the signs and symptoms, was diagnosed with pneumonia, which was causing exacerbation in the COPD. Your underlying condition, which is causing all of that, is the pneumonia. So you would code that first, because that would be considered the etiology, and then you would code the COPD second as exacerbation. I have another. Hold on, I'm trying to think. I have another. Hold on. Let me give you something. Let me go to I'm going to give you something else. Give you another trick. Little tip here. Because remember, it's all about the visit. What the patient came in for. So, the patient came in with pneumonia. Patient had history of COPD. And the COPD is exacerbating because of the pneumonia. Pneumonia is the underlying condition. Let me know if that makes sense. And it would be sequenced first and COPD second. In the inpatient world, it could be either or. It would just depend on which code pays the most. That's the difference. But when you're going by the guidelines, you are coding the underlying condition first, because that is what the guideline states. Let me know if that makes sense to you. I was looking for something else for you guys. Okay. I wanted to actually go. Hold on. Because See, I have a professional book and I have a instructor's book. So, hold on. So, yeah, I hope you guys are enjoying learning this, or just a refresher to this, because I'm telling you, it's nothing like getting on that test and just still feeling lost, like you just get that anxiety. The minute you walk in the door, you're like, okay. But if you're very well prepared, let me tell you about my last story. When I went to take my test, and this was a time when I actually was like, okay, I'm ready, I'm prepared, and I actually passed my test. And the lady came up to my book. She said, this book is so well put together. Like, I need to take this book with me. No, I was like, no, that's my baby. You can't have my books. But this is how you become when you become this go-to coder. That's how you are about your books. So, yeah, I just like to share stories with you guys, because I know how difficult. What was chapter 10? I'm looking for the respiratory thing. I know how it is for you guys. It's going to be something, but I want you to know you got it. You can handle it. And I'm going to try to do as much as I can within the group to kind of help you guys maneuver through some things. I'm just trying to see what this study guide is actually saying also for your COPD versus your pneumonia. I want to make sure that I give you any coding tips that they are highlighting here. Okay. No, everything, look, I'm pretty doggone good. Go ahead, Katisha. I've been doing this for so long that I mean, like, I know this stuff like the back of my hand, but I didn't get this way overnight. I really had to bust my butt, just like you guys are doing, to get to this level. And just speaking on a side note, I'm trying to work on things where I can actually open up doors for students to not only just be mentored by me, but also for them to be able to work on a project that I may have that they can do, where they're actually working. I mean, they're going to be working, they're going to be coding, but they're going to be mentored by me, and they're going to be getting paid for it. So it's a job, pretty much. So I'm just waiting for everything to finalize, and for the students that's coming out of school getting certified. I'm going to soon be posting for those positions, and it will be a remote position, just because I just like remote. But I do have to make sure that you are, like, you're disciplined. But that is my goal and my hopes for my students, to be able to help them more. I'm so happy, Lydia, that this is helping you. I always say this, guys, you post what you need to post in here. Let me know what you want to see. I'm going to be doing this because I know some of you guys have tests coming up. And I want to be able to give you a little something. This is what it is like when you're taking one of my courses. I'm like this. I'm a hands-on instructor. I do hold your hand because I'm all about mentorship. I don't care how long it takes for you to get it. I'm going to hold your hand, and we're going to make sure that you get it. That's the one thing that I pride myself in. That's the one thing that I really try to expose in the marketplace when I'm talking about all of this stuff. I just want you guys to know that I am an advocate for you. And so I am trying to open doors in different ways so that I can help you guys. I can mentor to you as much as possible. It's a joy for me to do this. It really is. It's a joy for me to give back to you guys. So anything that I can do to help you, please inbox me. Let me know, hey Katisha, you went over so and so. Do you think you can do another live on this? And that will help me to better navigate. Now, what I think is because a lot of people have issues with like the COPD and the pneumonia, I might do a separate live that really breaks down that guideline for you guys. And if you would like something like that, please let me know. Just drop a 1 down and let me know if that's something that would be helpful for you, because I will do it separately. I will also do one, because another big one is congestive heart failure, learning how to code with the hypertension and congestive heart failure and your CKD. Excuse me. I can combine those together, and we can talk about that. I'm trying to think what else. I think I'm gonna do a posting. Hey Penny, how you doing? I think I'm also gonna do a posting on the different fractures and go from there for you, so that you have an understanding of what that is. And when I do the fractures, I'm going to send out a worksheet so that you guys actually have a picture of it and you have a better understanding of what those hairline breaks is, so you know what to look for when you are actually coding. So I'm happy to see that this helped you guys in some way or another. Please do not forget that I do have open enrollment if you guys want to sign up for the CPC review. I will be going through every single domain. I will be holding your hand, mentoring you, making sure you get the information if this is something that you need, okay? If you want to do just plain mentorship, you can also inbox me for that, because that's what I love to do, mentor my students. All my courses are on my website. Yep. They're going to want, you need to go and look at how to do a stent, because they're going to test you on that. Christy wanted to know, is cardiac catheters a big part of the test? It is, because they want to know that you know how the heart works and how certain procedures are done. So one major thing that any of you guys can do to learn about that is to go and look at how a stent is performed. Okay? Go and look at how a stent is performed, because yes, I can. I most definitely will. Yes, because with stents, it depends on like what they're using and how they're going in. So one thing that I will do on a live real soon, because Christy, I think you said you have a test coming up soon. You have it in a couple of days, I think you said. Correct me if I'm wrong, because I want to make sure I get it out before you go to sit for your test. The one thing about it is when they go into your heart, normally they take a tube. It's like it kind of looks like a little hose. Okay. It looks like a little hose, but they also, once they go in, they take it up. They might have a camera on the end, depending on how they're going to do it. Because they normally put something down in the chest so that they could see it up on the x-ray real good. And then it's like a little small tube that they go into the heart, and then they take another tube and put it inside of that, and that might have your Synergy, which is like your drug eluting stents. So what we want to do is, to be better, because I like for you guys to have a visual of this, go on YouTube and look up drug eluting stents or heart catheterizations, or both, so that you can see the variation of how they do it. It's normally something very quick, like they take them to the cath lab, they get it done, and they come right back. It's nothing major, but I definitely can give you some key pointers about like when you see certain things in the chart, you can definitely know for sure without a doubt that this patient is going to, it has some clogged arteries, and they're going to want to go in and they're going to want to do a stent. And I want you guys to, when you get the opportunity, take a look at it. Take a look how they do a stent, because this will be on your test. It don't matter which version you get, is going to be on there, and you're going to have about 2 or 3 questions on it. So you're going to want to review how a stent is done. So yeah, I will do one soon. If I probably won't get that video up until Saturday afternoon, or first thing Monday, so be looking out for that. But I will be working on getting that done for you and making sure that you completely understand what is going on. So I'm even going to go back and look at a few stent videos that that's real popular, so that I can better assist you. I am so excited for you guys. This journey is going to be awesome. So on that note, we're going to look at the video. We're going to get that posted for you. And then I'm going to come on probably tomorrow. Maybe not tomorrow, because let me tell you, I've been running my mouth, y'all. Which I don't mind. But I might come on tomorrow and do the COPD and the pneumonia, like the complete breakdown of the guideline for that, to make sure you get it, for those of you who still a little iffy on it. But I want to make sure you completely understand it, so that you can put any little notes that you need to put, and I can give you any additional tips that I need to give you. And then we'll talk about congestive heart failure and how to cope with the hypertension, just to make sure you guys get that guideline as well. And I will do those 2 tomorrow. Christy, I will make sure to get your video up next week on Monday or Saturday. And I'll make sure to tag you in it when I get ready to go live to speak about it. So even if you're not able to jump on, you'll still be able to catch the replay. So if any of this information resonated with you guys and you thought it was helpful, can you please just let me know that it was helpful? You know, make a comment, whatever the case is. But if it resonated and you think somebody else will benefit from this information, can you please share the video out? Because that definitely helps getting more exposure to what I'm doing. Because I know other students need help and assistance too. And 2 is all about mentorship. Me networking with you guys, mentoring you guys, figuring out what you need, what you don't need. So I hope this video and this live has been very helpful. If you guys want to enroll in any courses, the name of my website is intuitivemed.org. It's a super simple website. It has all the payment information, payment plans. You just pick what course you want and you enroll in it. And I'm your girl. I'm your instructor. If you want to enroll in mentorship, definitely inbox me. Let me know. We can jump on a call, see what your goals are. If you want to go over or enroll in the CPC review, where I go over this stuff even more in detail, please inbox me. Let me know that you want to do that, so I can get you enrolled in the course. Other than that, I want you guys to have a awesome evening, and God bless. I'll talk to you guys later. All right then. Bye-bye.